So those are my cases. I hand over to Voraporn to finish.
Thanks, Kelvin. So next, I would like to share my early experience of Aflibercept 8 mg from Thailand. And in Thailand, it was just available last December, so quite like only 4 months for follow-up and quite short experience. But it's my pleasure to share 4 cases with you today. Let's start with case number 1. A 76-year-old Thai man presented for decreased vision in the right eye for 2 weeks, vision 20/125. And you can see from fundus examination, he got confluent drusen in both eyes. And on the right eye, you can see minimal subretinal hemorrhage. And OCT across the lesion, you can see PED with intraretinal fluid. So in this case, the PED doesn't look like PCV in my opinion, and I think of a RAP lesion in the first place because of the prominence of intraretinal fluid. So I decided to perform FA and ICGA, and on ICGA, you can see the hot spot with perfusing retinal arteriole and draining retinal venule, and this confirms the diagnosis of RAP or retinal angiomatous proliferation or MNV type 3. But at the first visit, we discussed about treatment and the patient denied for injection. He was afraid of injection, so I say that's fine, then let's see again next 2 weeks. 2 weeks later, here's the OCT. So we can see the rapid progression of PED. The vision remains the same, but in many scans, there are increasing intraretinal fluid, so the patient agreed to start treatment. So at that time, we give Aflibercept 8 mg. Right after the first injection, you can see a significant reduction of PED, all fluids gone. The vision improved to 20/63, so the patient is very happy. So I gave him the second shot of Aflibercept 8 mg. And at the next follow-up, you can see continued reduction of PED with complete resolution of fluid. So he got the third dose, and I follow him every month, about 8 weeks from the last injection now, and he remains inactive. So this RAP case shows rapid anatomical and visual improvements just after the first dose of Aflibercept 8 mg. Now let's move to case number 2. 82-year-old Thai woman presented for blurry vision in the left for 2 weeks and vision 20/50. In this eye, the OCT show PED with subretinal hyperreflective materials, and the FA and ICGA suggest the diagnosis of occult CNV or MNV type 1. In this case, and here's the multiple scans at the first visits across the lesion. You can see subretinal hyperreflective materials, subretinal fluid, and also PED. After first dose of Aflibercept 8 mg, you can see complete resolution of all fluid. The shram much reduced in the amount, and the PED also shows significant reduction after the first dose of 8 mg. So again, this case shows rapid reduction in both anatomical and visual outcome after first dose. Here's case number 3, a 72-year-old Thai woman. Actually, this patient had no visual symptom, just come for yearly checkup, but we saw some abnormalities near the disc in the right eye. OCT across the retina show something look like PCV, and it confirmed on ICGA in this case. So in this case, actually we follow her for a few times, and then when we started to see prominent subretinal fluid, we discussed about the treatment. So at this time, we try Aflibercept 8 mg. And after the first dose, you can see that serous PED had completely disappeared. And after the second dose, the fibrovascular PED have significant reduction in the size. So this case again show rapid reduction in the anatomical outcome, but visual acuity didn't change because the vision is very good in the first place. And here's the last case. 79-year-old Thai man presented with subretinal hemorrhage in the right eye. Vision 2063. OCT across the lesion shows subretinal fluid. Sharp peak PED with intra sub-PED show hyperreflective ring. So this is the appearance of PCV. But the patient denied for ICGA, so we start treatment right away. And this is multiple scan across the lesions. After 8 milligram, you can see complete resolution of fluid and significant reduction of fibrovascular PED. So from my experience, I saw excellent visual improvement and also anatomical outcome. And most of them show significant improvement right after the first dose of 8 milligram. And here is the case that I show across variant subtype of neovascular AMD, like NV type 1, occult CNV, PCV, and also RAP lesion.